recycle themselves. For instance, planting gum trees. We all know that gum trees have what? A life cycle for 5 years. And once planted, you don't need to replant them. When you cut them, they'll shoot out and grow again. We are also looking at something that can be recyclable. Right, so what's our focus as engineers? I know as we gather in this auditorium, we are from different sectors. So our focus is on mining, is on agriculture, is on transportation, industrial processing, construction, food production, water supply, clothing, PPE. I saw someone exhibiting there. I was happy. We are also looking at energy development. Maybe just touching a little bit on clothing and PPE. One day I was taking my car for panel beating after I was involved in a slight car accident. I was shocked with what I witnessed there. At one of my panel beaters, he had burns in his hands from here up to here, and I was like to him, what happened to you? So he was narrating to me what had happened to him, how it happened. He basically said the type of gas they use requires acetylene, but now they are not fully registered to be able to acquire acetylene from our established gas suppliers within the nation. What do they do? They take a certain stone, I'm not sure if you know it, then they will mix it with the other chemicals they get within themselves. And the moment that mixture is done wrongly, it will form a blast. So that's how we got all those burns. So I'm sure this is why we are pushing forward for providing affordable and sustainable solutions, engineering solutions to the informal sector. So that's the background of STEAM Team, the company that I represent. I'm just going to take you through a small example that we have set for you for an affordable and sustainable solution that can be offered to the informal sector. And our main focus, obviously, was on agriculture. Right, that's the traditional farm steam boiler that we normally know. And obviously, with this one, the challenge that most farmers face is the capital outlay that's required to acquire one. We are talking of something that ranges from 20 to 30,000, just the buying of the equipment, and not to mention the registration with the factories and works and the annual inspections and maintenances. That also is another figure that's there. If something else happens, we'll be talking of additional dollars to that. And focusing on agriculture, mainly tobacco farmers, the government overview for small-scale farmers, for the large, for the traditional farm boilers and heaters are not ideal for all applications. That is something that has to be agreed on, and they are deemed to be too large and sometimes expensive for emerging scale farmers. And the single main concern for small farmers generally, as we have noted in the previous years, the accidents that are being experienced is on safety. There you see, it's an extract from one of our local papers, an accident which killed 3 people and injured 1 when a tobacco curing boiler tank that they were working on exploded at water farm. And I've also put another example of another accident that happened on another farm locally as well. So in trying to mitigate all these problems, as a company, we've developed something that we call a vapor producer, something that is very small, that uses scrap metal for its production, for its construction. The design is simple, it does low evaporations, it's safe to use, and will not have to comply with the factories and works because it's not a pressure vessel. It's easy to operate, and it's also transportable, which means it can be used by more than one farmer, as opposed to our traditional farm boilers that can be installed, and once installed, it's a fixed and immovable asset. And it also does not require electricity. So this is generally the steam vapor that we designed, and we are trying to push that to the market, especially to small-scale farmers within our country. Let me just go back. It's called the Chibi vapor generator. You may ask why we called it Chibi, so that we for wherever it should be used within the country, it will remind you that it originates from Mashingo, just Chibi across the road, sir. So that's the design, that's the cross section of the water vapor, and there you go. It can use coal or wood, but obviously our main focus on this one was wood, and we had wanted to talk more on how to plant trees before we can sell the idea. Generally, the cost is opposed to the traditional farm boilers. This one can only cost is less than 1,200 or less, depending on the scrap metal that you'd have gathered to manufacture the steam vapor. There it is. That's how it looks after you'd have completed. And this is another example. This one is a chiller. It produces ice using biomass. It's an ice flake unit. It's also very cheap. We are still developing the model, and we're working around that. We are hoping it will be used by small-scale farmers, especially chicken farmers around town and beyond. I thank you.
Thank you so much. You are not leaving the podium yet. Please join me there. Right. Before we take a few questions, my brother, you mentioned that we need a design that can be used over and over and over again. Interestingly, we have always discussed at different fora that a good design is a design that, though remaining steadfast, can also embrace and is open to new technologies. If a design is open to new technologies, then it's capable of evolution. So, as we work in our spaces, as we come up with those designs, it's imperative that we make them open to new technologies. Thank you so much, my brother. That was a powerful presentation. I think before we move on to the next, we will take some questions. Where is our portable mic and mobile mic? Portable and mobile mic. Hello. Thank you. Right. Any questions? Maybe while people are still digesting and coming up with questions, I'll also ask Engineer Pardon to come this side, because there might be one or two clarifications, since tomorrow we're just coming in and going into the plant. So we'll take clarifications and questions for the next 5 minutes. Thank you so much.
Thank you. I just want you to comment the cost of the Chibi contraption, and as well as the ice maker, and also the maintenance aspect. how costly is that?
We'll take another one while he is noting the question. Another question?
Thank you, Chair. Quite an interesting issue on the Chibi steam generator there. I think this would be interesting and a solution for farmers against the backdrop of accidents that we have been having, where you remember that we lost quite a number of farmers when they were curing tobacco, as they were using the makeshift drums, makeshift boilers. They will just take a drum and then, without even knowing the thickness of the drum, they will put water and apply heat so that they can tap steam to cure tobacco. But what I would also want to understand from the presenter is this model, is it continuously producing steam and storing it? Is it building pressure within the structure? And would be very much interested as well to just come and carry out some inspections, especially if it falls within the confines of RGN 279 of 1976, which is the boiler and pressure vessels. So maybe he may want to comment, and we are very much willing to come in and carry out inspections as well.
Thank you so much. Speak of signages and homegrown solutions. Any other question? Yes, sir.
Yeah. Thank you very much for the presentation on the Chibi. I notice you are focusing more on wood and coal, which are non-renewable. Do you have any scope for some solar interventions?
Accommodation for solar interventions. Another question. The last one before we give him an opportunity to respond.
Okay,
yes.
Thank you. Thank you. My question is directed to Engineer Pardon on Dinson Mine products. I just wanted to find out that are we exporting the finished product to any countries? I heard we are exporting iron ore, which needs further processing. Are we at a stage when we are now exporting the finished product?
Engineer Dinson, value addition is coming your way. Ladies and gentlemen, I'll give them an opportunity to respond before we take 4 last questions. I'll ask you to start. Thank you.
Thank you very much from the last question. Our company is called Dinson Iron and Steel Company. Like I've said before, it is a manufacturing company that is registered under the Factories and Works Act. The mine is a separate entity. It operates separately. Tomorrow we'll be visiting the steel plant, which is responsible for getting the iron ore, the coke, and the limestone, then converting that into pig iron, which is a raw material in the production of steel. The steel is what comes in as steel billets, as rebars, as wires, and other steel products. So yes, we are exporting the finished products, which are the rebars, the steel billets, and we are also even exporting the pig iron. The pig iron is not a raw material, it's processed iron ore. We are mining iron ore at a different plant, then bringing it by road 7 kilometers to our steel plant, where we then process through the process of beneficiation that we have talked about in the presentation. So we are not exporting iron ore, we are actually processing the iron ore to give us the products that I've talked about, which is the pig iron and the steel. And even though the other countries and other organizations are buying pig iron, there is more that we can be getting if we were to sell steel products. But however, because we have got a lot of it, the local market is only able to use about 10% of what we produce. 90% we are all exporting. So even at full capacity, if Zimbabwe were to be revived to back the 1990s stage, they will still not be able to consume all our products. They will only be able to utilize about 10% of our produce. I don't know if I've answered you well.
Thank you so much. That's value chain. That's the value chain from mining, that is extraction, to processing. Right. But quite an interesting fact which he has revealed. If we as a country are only able to consume 10%, it's speaking to other issues. I think it's good that we are growing. It's provoking us to say, as we grow, as we industrialize, our consumption definitely should go up. So, very thought-provoking. Thank you so much for the response. I'll go over to my brother Julius. There are 4 questions which came your way. Over to you, my brother.
Thank you. 4 or 3? I could have missed.
Sorry, 3. 3, yes.
Okay, thank you. Let me just start from the bottom. Where you asked if we have any scope that on solar interventions. Basically, my presentation, if you followed through, I was presenting on affordability and sustainable solutions for the informal sector. Generally, this presentation, how I viewed it, it was supposed to prick the minds of the engineers in this auditorium to see how best we can assist the informal sector. Yes, I've given you an example which Steam Team is developing, but that's not the end of it. I'm saying more is to come, but to come from the engineers who are listening to me. So yes, initially, as we speak at Steam Team, we haven't developed something that uses solar as yet, if you are answered. Then the next question that I'll answer is on the maintenance cost for the chibi and the ice chiller. The ice chiller is a concept that we are still developing, but I'll answer on the chibi steam vapor. Well, the maintenance cost is very, very low. I wouldn't think there is any, as long as your valves are working well, which to me are the critical components of this aspect. The other areas is just steel and pipe. So that one you shouldn't worry about. Then the chief has also asked on the design parameters of the chibi boiler. Surely it does not build up pressure continuously. It doesn't have any continuous rating in terms of pressure. And we are very free for you to, after we make one, you come and do your inspections. Even the operation side of it, you are very welcome at our offices. I thank you.
Thank you so much. As you were responding, I was thinking of a related SOP in terms of the operation of the equipment. You have exhausted the 3. If there are other questions, I think we can take 3 more and then move on to the next presenter. Any other question? No question. Oh, there we are. Microphone coming your way, sir. Just lift your hand so that he can see you. There we are. Okay, you will come back to you, sir.
Okay. Engineer Patton, thank you very much for your presentation. You advertise Gibson Iron and Steel quite immaculately. We can't wait to see your plant. Maybe if you can just clarify the type of PPE that we need to bring so that we come prepared tomorrow.
Engineer Patton, over to you.
Thank you so much. If I remember well, we were advised that everyone who will be expected to be coming in with their helmet, with their work suit, with their safety shoe. When you get to the plant, you will be given reflective visitors jackets, and you also be given masks. There will also be some registration when you get there. You sign in when you get to the plant, and when you go out, you also sign out. So for the visitor, what you're expected to be having on you is already in your work suit, your helmet, and your safety shoes. There are those work suits that are short-sleeved. They are not recommended. We'll be expecting something that is full-sleeved. Short-sleeved work suits may not be allowed as we get in. Thank you.
There we are. Engineer Patton, confirm we are doing the steel plant. I can see other people might be thinking that perhaps we will do the underground component, but I believe it's the steel plant, right?
Yes.
Thank you so much. Right, we're at a hand there.
Oh,
Yes.
Okay, my
Over
question
to you.
is on the chibi, the one that is replacing the drum. So I think on the replacement, you mainly mentioned the safety aspects. In terms of quality of the steam, how is it going to be different from the steam that is coming from the drum?
How? The quality. Maybe before you respond, can I take another question, the last one? Another question, yes.
Yes, I wanted to motivate the scope for the STEAM inventors in relation to solar, which was already suggested by another participant, and gas. I come from a local authority, and of late, the hazard that the firefighters have been expressing to our office and asking what can be done is solar, because of the fires that are coming out of the poor or wrong connections at the houses. So they are saying almost every week they have to rush to houses, properties that are burning because of solar batteries, or some explosion that will have happened. So I think the shortcuts that you are talking about, perhaps we need the engineers in this room to come up with some interventions, some innovations that will make it easier to harness and use the solar energy. The same applies with gas. LPG gas, we also have quite a number of incidents that have happened and are exposing our firefighters to hazards because they have to go and attend to those fires. People are selling gas from their homes, from their bedrooms, and because it accumulates in the confined space by having such explosions. So can we have more user-friendly technology, technology that will be easy to use? Otherwise, we will lose property and lives. Thank you.
Thank you very much. Over to you, brother.
Thank you. The last contribution was just a suggestion, and thank you for that. I'm sure the House is taking note. Then the question that has been addressed to me is on how the quality of steam in relation to the one that we are trying to replace is. I think what we need to understand is the moisture content that we require when we are curing tobacco. And once we understand that, that's how we'll be able to work around. Obviously, we'll be having the temperature and moisture content gauges within your bands or your kilns. So do not worry about that one. It's well catered for. Thank you.
Speaker, thank you so much. Ladies and gentlemen, the two gentlemen deserve a pom-pom. Thank you so much, engineers. We now move on to the next session. I'll ask my sister Diana. Diana? Oh, yes. She will assist me with this one. Over to you now.
Thank you so much, Engineer. Good afternoon to us all. We feel tired. So maybe can we stand on our feet for a bit and have an energizer? So kindly stretch yourself. Just turn to the right. It's always difficult to do a presentation after lunch. So let's give ourselves a stretch, a big stretch. Stretch to the left, straight to the right. So, okay. So let's continue stretching upwards. Let's move to the right, to the left. We have entered the session of wellness. I'll just leave Engineer Marunza to do an announcement.
Just a quick one. Before people leave the venue, we remember tomorrow morning we are going to visit different companies. And here, as we were registering, people would then choose the companies that they want to visit. And we have 102 delegates that registered to visit Dinson. And for Great Zimbabwe Hydro Power Station, we have 134 who registered to visit Great Zimbabwe. But we have got a limitation. Great Zimbabwe Hydro, they say they only require 30 people. They can accommodate only 30 people. And then we also spoke to Delta. Delta, we will have 10 people that will go to Delta. So please bear with us as we are going to then have the first 30 people who registered, because you were registering online. So the first 30 people will then go to Great Zimbabwe Hydro. And the following 10 will then go to Delta. So if you can allow me just to call out the names, it will not take time for those that are going to Great Zimbabwe. So I'm just calling those that are going to Great Zimbabwe. The rest, if your name is not here, it means we are going together to Dinson. Are you happy? So we have got Engineer Nssa Tendai from Zimbabwe Power Company. These are the ones going to Great Zimbabwe. We have Chikosha Kudakwashe, Mega Market. We have Dube Nyasha, Delta Beverages. We have Gweru Kudakwashe, Delta Beverages. We have Mbedzi Hillary, Delta Beverages. Kufa Kutane Victor, Zimbabwe Power Company. Mandoreba Cynthia, Mangondoza Kundai, Chinamano Elwin Tinashe, JK Matthias Mchechetere Kudakwashe, Marume Tawanda Chaus, Anyane Bushevenkosi, Miti Robin, Mandaza Victor, Josiah Nyue, Shtakure Mo Blessing, Ndlovu Tuvelile, Jingo Renias, Wellington Nyamakao, Rongai Gledmore, Matorwa Peterson, Wovet Nomudaishe, Zinanga Tafazwa Euphenia, Matiashe Clinton, Makone Setinashe Gilbert, Karenyi Ashton, Majowa Shelter, Mutandwa Collins, Nduku, Julius Tinashe. So these are 30 names that I've called. It means these are the ones that will be going to Great Zimbabwe Hydro. So please, if you had registered for Great Zimbabwe and your name has not been called, we will be going to Dinson together tomorrow. And then the following 10 people will then go to Delta. We have Chindenga Charles, Makwembere Clayton, Madzamba Timothy, Nyagwea Aaron, Mandoreba Remnant, Tavengwa Tinashe, Bile Ashton, Mahumucha Mnyaradzi, Wiridzai Bernard, Govere Letwin. So these 10 people will then go to Delta. Please bear with us. It means the rest, which is about 80, you have been moved to Dinson. Everything is sorted out for you. The buses will be here by 7 in the morning. So we meet tomorrow. We just thought we needed to highlight this before people leave. Thank you.
Thank you, Engineer Marunza. All hope is not lost. Next year we might go again. Okay, welcome to the last session on integrating wellness into occupational safety and health. We are privileged to have our 3 panelists. It's going to be an interactive session, and we are going to discuss in detail. I would like to invite our 3 co-presenters for this session. We have Ms. Sitembiso Maseko. Ms. Maseko is a wellness coordinator in the public and occupational health experience and has experience spanning over 4 decades. Her passion in training in community and occupational health fields, programming health and wellness initiatives, and conducting social research. She holds an Executive Masters of Business Administration degree with NAST and a BA in Nursing degree with Nssa. She has several diplomas, including Community and Occupational Health, certificate courses, including Research Methods, Management Development Program, Train of Trainers, and Dynamics of Successful Management. She is a trustee in some board, a member of the Zimbabwe Occupational Health Nurses Association, Zona Advisory Board, past treasurer of the Zimbabwe Institute of Occupational Health Practitioners, past president of the Zona, and past member in the technical committee of the Zimbabwe Business Council on AIDS, a member of the country coordinating mechanism of the Global Fund, and had an opportunity to provide the oversight role in the 2015, 2021, and current tenures. She was nominated for the Legacy Building Leadership TV show as a solution provider and a game changer in her field in 2021. She gained experience from designing workplace wellness programs in line with the Global Business Coalition for Health and the Global Center for Healthy Workplaces Awards guidelines. So she is rich in experience. May we give her a big round of applause. We welcome you, Ms. Tembiso Maseko. We also have Dr. Tendai Otis Chikwanda. He is a medical doctor. Dr. Chikwanda is a well-rounded and seasoned public health specialist who has over 20 years of experience. He has been exposed to different health systems, having worked in DRC, Swaziland, South Africa, and Zimbabwe. He has special interest in research concerning factors associated with diseases and injuries among workers. He is currently working at Nssa as the medical officer in charge of occupational health services. May we give him a round of applause. Also to the panelists, we have Dr. David Mandisera, who holds a doctorate in occupational health and other degrees. That includes a master's in safety, health, and environmental management, a postgraduate diploma in the same field, a bachelor in nurse education, and diplomas in mental health and general nursing, and several other certificates. Currently, he serves as the Safety, Health, and Environment SHE manager at Nssa, where he oversees safety, health, and environment strategies. May we give him a big round of applause. So we are going to have a brief presentation by our guru, Ms. Sitembiso Maseko, for just 15 minutes. Welcome to the podium, ma'am. Let us give you a round of applause.
Good afternoon, ladies and gentlemen. Are you well? I'm a bit worried. Since morning, we've been seeing more gentlemen than ladies in the podium. Are we saying, ladies, you don't want to be engineers? Or where do lady engineers go? Do they divert or do they decide to run away from the gentlemen? Yeah, it's food for thought. Okay, maybe can you share the presentation? Is the presentation coming up? Okay, maybe whilst we wait for the presentation to come up, the topic that we were given as the panel is integrating wellness into occupational safety and health, a technological approach to enhancing worker well-being in the future of work. Do we have the presentation? The overview? Who has been running with presentations? Anyway, maybe I'll have to make do without the beaming of the overview. As a way of introduction, wellness and health are a workplace issue as they positively impact on the safety. As they positively impact on the safety, health, well-being of employees, families, and organizational productivity. I'm sure we all heard somebody talking for and against either wellness or safety programs at the workplace. Wellness initiatives mostly address the H aspect of the OSH acronym. Successful wellness initiatives hinge on the availability of legislation, enforcement arrangements, leadership commitment, employee involvement, technological innovations that we are talking about, and allocated resources. I'm sure most of us, we still think that wellness initiatives are an expense. They are not an expense, but they are an investment. Yes, the presentation finally is up. Then the theme, occupational safety and health technology and the future of work. That is an answer to addressing integration of wellness initiatives. So what is wellness? Next slide. Wellness is a choice to assume responsibility for the quality of your life. We look at the mental, physical, and social aspects. There are several domains of wellness, several domains which include the emotional, the social, cultural aspect, including Maslow's financial issues and the Maslow's good one, which talks to issues of sex. It begins with a conscious decision to shape a healthy lifestyle. It is a term that we use for health promotion, where we talk to prevention and promoting good health. It reduces healthcare facility attendance and improves productivity by maintaining the health of the employee at their highest productive potential. A healthy worker, ladies and gentlemen, is healthy, is productive. So in a nutshell, that is wellness. basically looking to everything pertaining to a human being. The mindset, the issues of stress, issues of energy. If a worker is not energetic, don't expect your targets to be achieved. The issues of fitness, issues of balance. I was impressed all morning. I've been hearing people maybe talking to that aspect, although it still needs to be improved at a lot of health spaces. So why do we even bother running wellness programs? Specific objectives of wellness programs include identification of knowledge, attitudes, behaviors, and perceptions that affect employee health. If we have that baseline, then we will ensure that our employees are healthy. It also helps in the identification of risks that expose employees to ill health, injuries, and stress. It helps in the identification of prevalent diseases and conditions with a view to developing intervention strategies. If you don't have a baseline information about the employees that you service you, then you may fail to develop intervention strategies. As we are all aware that these days issues of stress management are topical. It also helps in the monitoring of lost production time through illness and injuries. It ensures that wellness programs filter into families and supply chain. If a worker is at work and all is not well at home, then it doesn't help because they won't give you the desired results. And if we don't take care of our supply chain, then it might not help. So what are the principles for good health? It starts off with self-responsibility. Nobody, ladies and gentlemen, will be responsible for your health. You take care of your health. Although I also ask myself, self-responsibility, does it apply at the workplace? Do we have the conducive environment to ensure that employees have that self-responsibility? Or we have those limited workspaces where workers can't even have self-responsibility because they are just requested to work under certain conditions that do not promote good health. And it also speaks to issues of exercise and fitness. Do we ensure that employees know that when we talk exercise, we don't just mean lifting? Because I remember talking to a certain group who used to say, okay, we lift a lot, but they're just using the upper part of the body. Exercise speaks to maybe involving all the muscles of your body, including the internal muscles, which somebody said sex is the best exercise because even the smooth muscles actually work. It also speaks to good nutrition. Do we offer good food or meals or a basic meal to employees? Or we expect them to work so hard, lifting that steel or whatever, then they have a soft drinks and a bun. It speaks to critical and analytic thinking. Do we give people the leeway to input into the organizational development and advancements in organizations? And it speaks to issues of emotional intelligence. AI, for example, the ability to identify issues, feelings. Are people allowed to express themselves at workplaces? It speaks to effective relationships, human treatment. How do we treat employees at the workplace? Do you give that humane nature to say, okay, these are the people who bring in the money into this organization? Somebody in the morning said, we don't want a man dying because they are trying to give another man money. So guys, ladies and gentlemen, let's ensure that our workers are safe. And it also brings the meaning of life and purpose of spirituality. So let's ensure we afford them that. Right, let's look at the key strategies. Now we're answering the topic that we're given. What are the key strategies and technologies that can be employed in the wellness integration process? We look at wearable technologies. I think Chia Wakiwe almost took our presentation. Thank God, thanks to time. Time decided to steal it because he was coming hard on this presentation. Okay, there are issues of wearable technologies. How do these help? These health monitoring devices, especially things like smart watches, fitness, what do you call them? Fitness trackers to monitor the vital signs, the physical activity, and the role that employees and management can use to develop strategies. And we can also look at issues of economic sensors. These can actually say, guys, you've been overseated for too long. Yes, she came in and said, let's stand up. But if we had economic sensors, they could have reminded us that it's time to stand up. Otherwise, the muscles will be strained. So these are some of the issues or ways that engineers and other occupational safety practitioners can actually devise or purchase for the employees at the workplace. Then there's the issue of AI and data analytics. These can be either predictive analytics or personalized wellness programs. In predictive analytics, we are looking at analysis for data that we collect from wearables, and then we develop intervention strategies using that analyzed data. On personalized wellness programs, that's where we use data analytics to tailor-make wellness programs to suit the specific workspace, because workspaces are different, and workplace wellness programs cannot be uniform. And then there are virtual or VR, at least if somebody was here earlier who was talking of abbreviations, we managed to put them in full: virtual reality and augmented reality. On virtual reality, we are looking at training stimulators, that's VR, and stress and maybe stress relievers, which are under augmented realities. What do training stimulators do? These are used to create immense training. I'm sure we are used to them being used mostly by pilots and maybe by drivers, but we can take them into the workspaces where during induction we can use them to make people get the feel for the real workspace and the machines that they will be using. I thought this is one of the most maybe realistic and useful way that we can use for induction. And then stress relief. Guys, workplaces are stressful. Yeah. So we need applications that can provide relaxation experiences whilst people relax. And then the other intervention that we can use is remote monitoring and telehealth. On telehealth, what are we saying here? We are talking of providing access to healthcare professionals so that people can access them anytime they have a challenge. So that is another way of trying to integrate wellness into workspaces. And then the issue of remote work. I'm sure COVID-19 introduced us to another aspect where they said people can work remotely. And this is one of the tools that can monitor workload and stress levels whilst people are working away from the workstations. So these are some of the innovations that we can use to integrate issues of right. The other thing, mental health is topical the world over. So we can use mindfulness and stress management apps that promote mindfulness and meditation and management of stressors. So it's up to you engineers to try and assist us. And then anonymous feedback tools. I know we have a lot of things that we use for feedback at the workspaces, but are workers comfortable with that? Let's use some things that are anonymous and which can never lead somebody into being pointed a finger, because at times people are persecuted for saying the truth. If they are not happy with their workspace, they are found to be rebellious, they are said to be rebellious, yet they will just be trying to express their views. If you think of it, ladies and gentlemen, we spend 3/4 of our lives at work. And when are you going to relax if you can't even air your view? And then there are collaborative platforms like wellness communities. Maybe most workspaces now have online platforms where employees can share tips on health. Those are very important. At some workplaces, they use the groups of peer educators to share information as quickly as possible and then talk to their peers as they work. These are some of the platforms that we can use. And then the feedback loops, these are regular surveys. How many of us do surveys to identify what's happening at our workspaces? It is important to always do baselines, then you do continuous surveys, and always correct whatever will be an anomaly. Then there's the integration with the safety protocols. As we are saying, let's integrate wellness with safety. Here we are looking at holistic safety programs where we integrate wellness into traditional safety protocols. This helps ensure physical and mental well-being of the employees. And then there's the emergency response plans. We had the mining where we are visiting tomorrow, talking of emergency response teams. Let's have them, but we want maybe technologies of communicating, because you find that you can have those documents, emergency response plans, maybe is it for mental health issues or anything, but they're in your cupboards and people don't know about them. How can we use technology to ensure that everybody has access to those? So these are some of the technologies that we can use to integrate wellness programs. So wellness technology, you see what it does when people are tired. Right, so wellness initiatives, what are the key focus areas when we talk wellness initiatives? We look at all the aspects of the workspace. The air quality, where does wellness come in? Wellness comes in with the respiratory protection module. Those are the people who will monitor the whether employees' respiratory systems are working well. And then there's the thermal exposures. We actually look at how does that affect the workers. Radiation protection, we ensure people are educated and people are examined to check if there is any effect resulting from radiation exposure. The noise levels, these are the people who run with the audiometries to ensure that people are healthy. And the musculoskeletal issues, workplace bullying. A lot of us, we bully each other. When we sit here, we appear like angels, but out there, some of us really harass people. And then they also run with well-being initiatives. I can see people whispering to each other. They know who is bullying who. Okay. Then there's the issue of fatigue management. Fatigue, ladies and gentlemen, is a cancer at the workspaces that we cannot underestimate. I'm glad to be talking to engineers. You talk so much about plant maintenance. You are so good at protecting the machines, but you protect the human being who operates those machines. Let's take care of those people and ensure that we let them work and rest and ensure that they get the necessary health assessments as required by their type of work. And the wellness module also looks at the early identification of diseases and conditions. It's so easy to treat somebody with high blood pressure than to wait till somebody has a stroke, where you now have to modify access to entry to the office, or you have to be using a wheelchair. It is important to identify diseases early and manage them and prevent complications. So what are the core of wellness programs? What is it that they give us? They actually increase morale. They increase productivity. They work towards a healthy bottom line where all of us at the end of the day can happily drive one of these big cars that I'm seeing out there. It also reduces healthcare costs. I'm glad you're saying you're setting up a health facility at your plant. You need those health facilities because you will be treating people with minor ailments before they get complications. It also helps in reduction of absenteeism and presenteeism. And at the end of the day, you get a healthy workforce. In conclusion, ladies and gentlemen, before we get into the plenary session, consider wellness initiatives as an investment and not an expense. Occupational safety and health programs that prioritize worker well-being can be achieved if organizations leverage on technology.
Technological advancements not only enhance productivity, but fosters a positive work culture where employees feel valued. Because if somebody feels valued, they'll give you the desired results. So you will recoup returns from a healthy workforce. Integration of wellness into occupational safety and health is crucial for sustainable workforce development design programs. So it means we need to design programs with continuous improvement in mind. I think I heard somebody commenting after the last presenter to say, devise those programs with continuous improvement in mind. So we need to offer meaningful wellness initiatives to strengthen return on investment. The shareholder is breathing on your neck. They need good returns on investment. A healthy worker, ladies and gentlemen, is productive. So engineers can assist in the identification and acquisition of digital apps to help monitor health aspects and assist in advanced stages of life. I'm sure you know Zimbabwe, the workforce will be working to 70. You can imagine the level of forgetfulness. If you don't get proactive now and start getting apps that will assist you, remind us what to do, you might find us very useless at the workspaces. So it's important to make sure you help monitor health aspects and assist in advanced stages of life. We're talking to issues of reminders, economics, deviations in health-related numbers, and warnings on upcoming dangers. Otherwise, we'll be having people collapsing left, right, and center. Ladies and gentlemen, that's the overview. Thank you.
I think the presentation deserves a bigger round of applause. It was indeed an insightful presentation, pregnant with information, rich. We can see the efforts of 3 of our gurus in the area of wellness. Allow me to begin our conversation from what the highlights of the presentation, the ones I got. I was wondering, on our theme for this engineers workshop, it says occupational safety and health, technology, and the future of work. So I was just wondering what the future of work entitles. So I then come up with the phrase, the future of work is in the hands of a healthy and well workers. So at the anchor or at the center of everything that we are doing, of our future, is a healthy and well workforce. Allow me to involve our panelists. I would like to pose some questions just to start up or to jumpstart this conversation around integration of wellness into OSH. We have a question for Dr. Manditsera. The definition of occupational health has evolved over the years. Can you kindly shed more light on this? Over the years from when OSH began, slowly the definition has been evolving. Would like you to shed more light on that.
Thank you, Diana. Thank you, Diana, for that question. Good afternoon, engineers. Yeah, I'm sure the definition has evolved. What we need to look at is the focus that was there on traditional occupational health and safety. The focus on traditional occupational health and safety was basically to look at physical safety, where you look at prevention of injury. It was also to look at issues to do with prevention of chemical splashes, hazards like noise and ergonomics. And lastly, it was also focusing on complying with these regulations or adhering to them.
But they evolved now. We have some other issue to do with wellness to augment the traditional focus, where we are now going to look at mental health issues, the social and well-being issues. Remember, there is a lot of occupational stress within the workplace. From the presentation, we had the issues to do with fatigue, the issues to do with burnout, which are pertinent issues, and also invisible issues within the work environment. Because only what we realize that somebody is succumbing to occupational stress is when probably they started to change their behavior. It's deviated from what we know them as. So basically it's invisible. Then also, it also focuses on financial wellness as well, where we look at organizations to look at assisting employees, what we call employer-assisted programs, issues to the school fees for children, issues to do with housing, because these are the issues that were actually causing some problems within the worker. Because if you look at as the traditional focus looked at those issues that I've talked, the three things, the physical safety, the health hazards, and the adherence to these regulations. Did we have a decline in workplace injuries? They continued rising, but why were they rising? Because there are certain things that will also contribute to injuries, issues to do with the mental status of the individual. That's why I talked about. There was need to put in a holistic approach in managing occupational safety and health in the workplace to augment the traditional focus. Sure, that's my response. Thank you.
Thank you so much, Dr. Manditsera. From the presentation, we heard of an attitude shift from that of viewing health and wellness as an expense to that of viewing health and wellness as an investment. My second question to you, Dr. Manditsera, is, do physical activities really have an effect on employee wellness?
Oh, thank you very much, Diana. Yes, physical activities have an effect on workers or on individuals. Remember, when you involve yourself in physical activities like football, running, jogging, whatever physical activities, how the body was made, there is development or release of what you call the endorphins by the brain. These endorphins that we also sometimes refer as feel-good home chemicals or the natural painkillers, these can actually suppress some elements of the brain that causes stress, like the production of the cortisol. That is the one that causes a lot of stress. So those physical activities now also have a bearing, because if those endorphins are produced, you are going to be free from stress, and also there is also some relaxation that develops after these physical exercises or physical activities. So that's the benefit that the body can actually get from physical activities. And also, I think we agree that after a physical activity, we have a better sleep on that day. So physical activities also promote relaxation because of those endorphins, those chemicals that are produced after undergoing some physical activities. Thank you.
We heard of key strategies and technologies that we need to integrate in our workplaces. We heard of AI, data analytics. There's been a lot of hype around AI. Dr. Chikwanda, how far has OSH embraced the use of AI to assist with the execution of the mandate towards safe workplaces? This is in reference to Nssa.
Okay. Thank you, Diana, for your question. It's a tough one. But anyway, as we are all aware, our current legislation does not cover issues to do with AI and digitalization. So it means we have to adapt to the new norm, which is the pervasive, presence of AI digitalization into the workplace. While we don't have any legislation to control its use, or most importantly, to make sure that it's safe for the worker. So the issues which need to be resolved in drafting legislation which deals with AI in the workplace, which deals with worker safety in the workplace, have to deal with, initially, we have to define this AI. Is it a person? Can it be given legal personality? This comes from the fact that if we look at certain capabilities of AI, they are even equal to of humans, or even, they surpass the capabilities of women, of men. So, if it is like that, then it means that AI can be given legal personality. This is also supported by the fact that, remember, AI is some level of autonomy to a certain extent, and to some extent, full autonomy. So, in the workplace, how do you deal with, say, an AI-empowered gadget or tool which can make its own decisions, which may harm the worker, either physically or even mentally. So we need to remove some of those ambiguities aside. Then we also have to look at the issue of the functions of AI in the workplace. One of the functions is to collect data about the workers' vitals, for example, performance levels, the output. Does that make the worker feel safe, physically and mentally? Because we also don't know what the employer uses this data for. It can use it for discriminatory measures, which can result in a worker being let go from work. So also need to know that issues of protecting the privacy and the secrets of the data of the worker are dealt with rigorously in any legislation which has to do with AI in the workplace. So I think, in short, I can say that would be my response, that our drafting of legislation to do with AI will need to be guided by removing ambiguities, which maybe currently we don't seem to realize they are there. Then you also need to be clear about, say, certain definitions, for example. We can say, who is a developer, for example? Who is a software engineer? Who is a user? Who is a provider? And of these, the employer as well. But who takes liability of the worker's health in the workplace, where there is the presence of AI, where there is digitalization? So in short, I think that would be my answer. Thank you.
Thank you so much, Dr. Chikwanda, for that answer. We've heard previously of the OSH bill that is coming. Has AI and digitalization been integrated into that bill?
Unfortunately, not yet, because we're focusing on the current legislation we have, which we have to regularize. So it was not factored in, unfortunately. But remember, with any legislation to do with AI, our bill, I think, has been in the pipeline for the past couple of years. But if, say, it included AI issues, you might find that by the time it is promulgated, those issues might have become outdated. So one of the challenges which we have to face up to with any legislation to do with AI will be that it will need to be constantly revised depending on the rapid pace of developments in the industry and their uptake in the workplace.
Thank you so much, Dr. Chikwanda, for that. To round up the session, before we go into the answer and question session, to open the floor to the rest of the delegates for questions. To you, this is my last question to you, Sister Maseko. From what you have experienced in the workplace as a champion of wellness, how best can we overcome the challenges or the stigma that are associated with wellness programs at the workplace?
Thank you, Diana, for that question. Maybe before I respond, can I just augment what Dr. Chikwanda said earlier about issues of maybe legislation on AI. Those who develop the legislation, I would urge them to involve the tripartite so that as it filters down, as we negotiate the processes at workspaces, there is no suspicion. Everybody is involved from inception and from the design stage, and it will get a lot better buyout. Yes, you asked on issues of stigma. So maybe...
Yes, challenges. How can we overcome challenges associated with championing wellness programs in the workplace?
Yes, as I said earlier, that most organizations consider wellness initiatives as an expense. You need buy-in from top management. It has to be a board issue where they sanction funding, because there is no program that can run without adequate funding. So you need buy-in from the highest level. I know with time, maybe once the programs are designed, mostly they are consumed by the shop floor workers, because top management, mostly they'll be getting services out there. But it will be crucial to ensure that top management is involved. I remember at some stage in one organization where training of wellness champions, the so-called peer educators in some organization, we had them stratified according to groups or levels. We had wellness champions for executives, wellness champions for directors, sitting down to be trained on wellness programs. That's when you can get buyout, and everybody will then understand and factor it in whatever training program that we have. I know this organization, whatever program that they have, there is a presentation on employee wellness as a business case. In that aspect, there will be no discrimination, because if you make it like that, people won't buy it in. You might find yourself with a wellness program which is not being used by anybody. So it's important to involve everybody, especially worker leadership, so that they understand that it's not maybe fact-finding for you to abuse or discriminate or fire people because of their health status. So buy-in should be from all levels of employee. Thank you.
Thank you so much, Sister Maseko. So the take-home message for me is implementation and implementation and implementation of all the key strategies and technologies we have had. Earlier in the morning session, we had a presentation on the municipalities where we were told about fatalities that happened in manholes. If only there were wearable technologies, the outcome could have been different. If they had employed AI or even remote monitoring, we wouldn't have those numbers in fatalities. So I guess this is the take-home message. I'll give the floor opportunity to ask questions, and our panelists will respond. Thank you. May I have the roving mic? They are available and on standby. Any contributions, any additions, any success stories on implementation of health and wellness in the workplace? Are we tired? Let us just, there's a hand over there.
Hello. Good afternoon. I might have missed the point, probably it's off topic, but we have been ravaged by the coming up of drug abuse in organizations. These have led to a lot of accidents, a lot of absenteeism from work, loss of production hours, and generally, the whole atmosphere in organizations has been disturbed by this high rise in drug abuse. Thank you.
Another question before there is a response. So Dr. Mansera can take the question on drug abuse. It's now called the drug abuse pandemic.
Good afternoon. I want to thank Dr. Maseko for taking us through wellness. I want to speak to the engineers in this role. Most engineers here, they are managers one way or the other. And you are here gaining information on technology involving wellness. I want to ask all engineers and managers here to please go and share all the wellness technologies and strategies that you have gained in this podium to your fellow subordinates or colleagues. Because most people out there, our colleagues, they lack knowledge. They are not aware of these technologies. They are not aware of the benefits of the wellness initiatives. I want to highlight that as engineers, as managers, we take care of machines, we maintain machines, we have targets. At the end of the year, we want to be appraised, we want to scoop awards, recognition awards, but maybe we forget that the greatest asset that we should take care of is our human resources. Please, engineers, managers, make effort to take care of your human assets, because those artisans, technicians out there whom you work with, some of them, they are not even aware that they are very important. Please regularly share wellness information with your colleagues. Make it regular, make it social. While you are working, share one or two things on a regular basis about wellness. Maybe if we do so, that small campaign that we do at work, it will help save lives. Because we are experiencing BP, deaths, diabetes deaths. So if you share information, it will help a lot. It will go a while. So thank you very much.
Thank you for that contribution. This was talking to information gap. There is a gap that exists within our workplaces that needs to be filled by all of us. Whilst Dr. Mansera can respond to the drug abuse question as more questions come in.
Good afternoon once again. surely drug abuse is actually a menace in our country. And not only in our country, even in other countries, from statistics that are there. But what we need to understand is what causes employees to abuse drugs. I think it's a pertinent question that we also need to look at. We need to look at our systems within the workplace. Are these systems allowing employees to verbalize their feelings? If it is targets that they are given, are they in line with their competence? Well, sometimes what causes drug abuse amongst employees is the issue that probably one is under-promoted, they higher qualifications, like the case in Zimbabwe currently. The jobs are not there, somebody just goes to take any job that is available. So that alone, that is doing the same things every day, some may succumb to stress because of that. Do we also have an open door policy at the workplace so that if somebody has issues that are bothering them, are they able to verbalize them? Are we assuring them about psychological safety? Say they verbalize their feelings and we don't condone or actually take them to task why they've said that. So it's also very important to look at that. And also, are we disseminating information about drug abuse at the workplace? Well, it's a pertinent topic which we also need to include within our wellness programs. We talk about issues to do with drug abuse, the possible causes of drug abuse, and how we can prevent it. And it's also easier as well to notice, because we know each other at the workplace. If we see some certain behaviors that are deviating from the normal that we know about the individual, we can actually be able to pick it up, say, probably this person is abusing drugs. But why do they abuse those drugs? Sometimes it's actually an escapist way from the things that bother them. They started to abuse alcohol. Today they'll start probably with 1 or 2, and eventually they take more and more. And there's the issue of intolerance where they cannot do without it. And they can actually abuse other issues like these days there's a lot of them, banje and the other things that you name. So it's also very important to look at that. That sometimes employees, they indulge into drugs because of they're trying to escape on the environment at the workplace, which they cannot change. So it's also very important to interrogate our environments within our workplace as we do our hazard identification and risk assessment. Let's also look at some of those things, because these are invisible things that can be there, but they've got an effect that is detrimental at the end of the day. Remember, individuals are different. Some, they tolerate issues that can be happening in the workplace, but others, they might not tolerate, and they become stressed. And for them to overcome that stress, they seek probably, they call it, is it Dutch courage? To say, maybe let me just go and take one, or let me use this drug, so that probably I'll have the courage to face it. They do it over and over again, and already they actually succumb to those drugs. I think that's my submission. Thank you.
Thank you so much, Dr. Mansera. We have 2 more questions and we'll round up. 2 more questions. Or
just a contribution. Thank you very much for the presentation on wellness. I really loved it, and it was quite something. Yes, you talked of technology being the future of work, especially in terms of wearables. My other contribution, I think, where we seem to be also having challenges is in the form of food, healthy food, nutrition. I think that needs to be added in as well. I think that is also contributing a lot to issues to do with health challenges. Sodium chloride, addition of too much salt and so on. So that aspect also has to come in as part of technology to try and balance out the type of food that people are going to be eating to become healthy. Thank you.
Thank you for that contribution.
Okay, good afternoon. So my question is more related to Ms. Maseko. You mentioned the key strategies and technologies for the wellness program integrations in the organization. So my question is, statistically speaking, how well receptive are the organizations towards these initiatives that have been put in place? Do we have success stories? Do we have case studies? Like, what's really happening? Because I'm just coming, I'm trying to be practical. Coming from an African background, the motherland culture, where mental health issues, especially pertaining to men, they are a bit more shunned out and less receptive. So some of these key strategies for wellness programs, integrations, I would like to understand how successful are they being implemented or integrated in these organizations?
Thank you for that question. The next question, we had some couple of hands. We can have the two last questions.
Thank you very much, Madam Chair. I think my question applies to the three of the panelists. I just want you to maybe assist us on how you can identify triggers for mental health. And also, when can you draw a line and say a workmate has mental health issues?
Okay, there was another hand up there. That would be our last question.
Okay, thank you. I would want to ask, how do we take a night shift in wellness programs? Because as an inspector, I faced some accidents that occur at night, and people may attribute the accidents due to lack of alertness. We know that maybe tolerance to working at night may differ from person to person. Is there a study that has been carried out maybe to shed more light on tolerance on working at night?
Thank you for the questions. Sister Maseko, I'll pose you the question on success stories. The question, has there been any success stories to health and wellness programs?
Yes, there are a lot of success stories. If I recall, like in 2011, 2013, in Zimbabwe, there were 3 organizations that were recognized globally under the Global Business Coalition on Health. And I know those organizations which people can benchmark on. It's a matter of communicating, a matter of adding value or showing the importance of wellness. And those organizations, if I tell you, they are doing very well on the wellness front and on the business aspect, because issues of communication are critical. Issues of involvement of everybody in every level is evident. So yes, there are success stories. I think the problem is that we fear. At times, it's not about money. It's about investing time, awareness creation, talking about what can help people. And then with time, it can be evident. Because if you train wellness champions or peer educators, you should be open with them that that's employee voluntarism. They won't get anything. But with time, management will find that they add value, and then they can recognize them as and when it's necessary. So success stories are there. They are definitely there. Thank you.
Thank you, Sister Maseko. To Dr. Chikwanda, maybe briefly, if you can answer on identifying triggers for drug abuse and mental health.
Thank you. That one in the workplace might be easy because remember we are not working alone in the workplace. First, you've identified the aberrant behavior, meaning the change in behavior. That is one of the first things you realize. You also realize that the person, maybe their eating habits have changed. And you also realize that maybe they're coming to work late, they're coming to work inebriated, or that they're falling more and more into a debt because they have to finance a habit which is expensive. So the triggers in the workplace can be noticed by the workmates, by the supervisors, and this can be supplemented by maybe information from home, from the family, to say that this is what is happening to my brother, to my father at home. He started taking this, he started taking that, and hence those triggers can lead to early intervention and maybe assist with rehabilitation. I don't know if that.
Thank you. Then lastly to Dr. Mansera, the issue of night shift and the role of wellness programs in alleviating workplace injury during the night shifts.
Thank you very much. The issue to do with night shifts, probably these are changes. The person's been doing day duties, then they now go to night shift. But what we need to understand is that looking at nowadays in Zimbabwe, people are just running around with other side hustles and the like. I would want to believe that sometimes from work, they finish work probably at night shift, 6 a.m., 7 o'clock, they go to do other work, other side hustles. So as they do that, they have no time to sleep. And probably they will finish that job probably around 1. They travel home, they sleep for 2 hours. They are again on the road to do night shifts. Well, this has been a thing that has been happening. I'm not very sure with other industries. I've actually realized it. Actually, the Minister of Health, a person who works at Paranayatka Hospital, the night shifts is 7 to 7. They finish at 7:30. They start at Avenues Clinic, where they finish at 4 o'clock. You know, their body has also its own issues that you cannot avoid. You obviously will get fatigued because of that if you do that for 2 days, 3 days, up to a week. And definitely the chances of errors, they also increase. So that could be the issues that cause a lot of accidents during the night for those who are on night shifts. Because they're not giving themselves time to rest. Their body needs rest. And they are doing these side hustles. So probably, and sometimes they don't even sleep at all. Because there are other, remember, the interface between work and home. There are also other issues at home. Come weekend, you're on night duty. Weekend, everybody's at home. Are you going to sleep? You might not sleep sometimes because you actually give a chance to embrace the children and friends if you are not actually strict on your sleeping habit. So it's also very critical to look at those things. That night shift on its own, I don't think there's a problem. But what we do when we are saying your night shift, you're doing other duties, other jobs, side hustles, and you can't rest. And this is what I think causes errors during the night, resulting in these accidents that we are talking about.
Thank you so much, Dr. Mansera. A round of applause to our panelists. As we come to the end of our session, I would want to leave you with a proverb which says, "A stitch in time saves 9." We should embrace being proactive rather than being reactive. A lot of people's lives hinge on us as engineers. I'll hand over this time to Engineer Marunza to give us the logistics for tomorrow. Thank you for an interactive session.
Many thanks to the team that led us during the afternoon session. We just want to emphasize on tomorrow's program. So tomorrow we have got industrial visits. And we say that we have got 3 different groups. The first group will be going to Dinson. And we want to leave this place at 7 in the morning. So that we can travel. Dinson is 150 kilometers away from here, which is roughly about 2 hours by bus. So we expect that if we leave around 7, by 9 we would have arrived. So please, the groups that are going to Dinson, we are urging you to be here at 10 to 7. So that we get into the buses and we leave. And then for the PPE requirements, you need to have your helmet, you need to have your safety shoes, and then a long sleeve shirt or jacket. We are also we are reminded to collect name tags in the registration room as we go out. So please, if you haven't collected your name tag, kindly go to the registration room and collect your name tag. These are the name tags that we will be using to identify ourselves, even as we get into the buses, particularly to Dinson, as we are going to various places. So please collect your name tags. Can I also request all Nssa staff soon after this program to meet by the poolside, so that we can have a small discussion in terms of the logistics. And then the group that is going to Great Zimbabwe. The group that is going to Great Zimbabwe is about 38 kilometers from here. So in about 30 minutes you would have arrived. So you can meet here at 8 o'clock. So the group that is going to Great Zimbabwe, you can meet here at 8 o'clock. But remember the names, we have called the names of those that will be going to Great Zimbabwe. So if your name was not called, we are together going to Dinson. We don't want to miss you. At this point in time, let me leave to Mr. Chibanda as he comes to highlight on the cocktail that we'll be having tomorrow again.
Good afternoon. It has been a long day. I can tell all of you how weary are now looking. Even at the back, I've got my team. They are just waiting for this announcement. Tomorrow, after our field visit, we are coming back to an event that may well be in line with what Dr. Manditsera was just trying to express, where he was saying physical activities can actually work well to produce endophiles that will suppress, those are elements that are brought by I think they are manufactured by the brain to suppress stress. So tomorrow, we intend to treat you to some good time. I'm actually having to plead on the dress code. Please, just look casual. Just try to avoid bringing a work suit or a work shirt. I'm also informed by Engineer Kufakunesu that Dinson is going to provide a reflective vest, so much that you can maybe wear yourself a khaki shirt which is long-sleeved, long enough, then you can receive the vest on top, so much that if you are coming from that end, it may be late for you to go wherever you are staying to freshen up and be here on time. But I know guys who are going to travel to Great Zimbabwe and those who are going to be locally around, they will most likely get the chance to freshen up. So for tomorrow, I'm pleading with all of you, please come prepared, wear your dancing shoes, let's enjoy ourselves. It has been a long day, and still tomorrow is still going to be a very long day, because we are going to be visiting and touring some of the places that may actually weigh us down. But at the end of the day, we've got to live some life. Thank you.
Just another update on the lunch requirements. So for those that are going to Great Zimbabwe and Delta, your lunch will be served here. Those that are going to Great Zimbabwe, Hydro, and Delta, your lunch will be served here. But for those that are going to Dinson, your lunch will be served at Dinson. Thank you.